Welcome to another Q&A session. Today we're going to be reviewing the top 10 questions in a rhinoplasty procedure. The first thing I like to ask is to find out what the patients are interested in first. Some patients want certain looks and other patients don't. Some want to be more natural and some don't. So at the end of the day, I think it's most important to figure out what it is the patients don't like about their nose. So my very first question in the consult is what it is about your nose that you don't like. Oftentimes patients don't like the bump on their nose. Sometimes they don't like the width of the bridge. Sometimes they don't like the width of the nostrils. Oftentimes they say the tip falls down. So, it really just depends on what each patient's goals and aspirations are. I even have some patients that say, hey, listen, I want to maintain my ethnicity. Some patients want the drooping tip. Some patients want the wide bridge. It's all dependent on each single patient. And so when we go through the consultation process, we review what their wishes and aspirations are. Then oftentimes I put my 2 cents in and I say, okay, this is what most patients ask for. This is what I can do for you. If you're interested in this, we can add this on top. And then between these two, we make a compromise and figure out what the best contour changes for the nose are for each particular patient. So it's customized for everybody. So this also varies. The general post-ops are 1 week to take the splint off, 1 month because it takes a month to be presentable. We'll talk about that later. 3 months and 6 months. Depending on the amount of swelling that each patients undergo, sometimes I'll see patients more often to do steroid shots or certain other things and tweaks to the noses. So it really all just depends on what we see during each follow-up period, but you'll definitely have several follow-up appointments after surgery. Very good question. I have a lot of singers and actresses and actors and voiceover people who have come in to have rhinoplasties done. Not one person has said anything about changes in their voice. So just for you guys to understand, when it comes to the rhinoplasty, from my perspective, all I'm doing is changing the outer appearance. I'm not doing anything deep within the nose other than maybe changing fixing the septum. But other than that, none of the deeper structures in the back of the head or the throat or the nasal passages are being interrupted. Very good question. I always say, during the 1 week mark, there's always a little bit of a shock factor because you're very bruised, you're very swollen, and the nose is a little bit over-exaggerated. We over-exaggerate the nose on purpose because we know there's a settling period and everything settles down. So it always looks a little bit awkward in the beginning, or I like to say funny looking, but not necessarily bad looking. It'll probably take a solid month before I like to call or say patients are what we call presentable, which means you can go out in public, you can go to the grocery store, you can go on vacation and not be self-conscious about the nose. So it'll probably take about a solid month before patients are comfortable with the appearance of their nose. Again, with that being said, the nose can be swollen for 6 and even up to 12 months and sometimes even longer. So do realize the final result might not be there until several months down the road. But again, at the 1 month point, patients are presentable and will feel good about their nose. Great question. So the bruising usually is located underneath the eye. Sometimes it can go into the upper eyes. You don't really see it in the cheeks. It's almost like the raccoon eyes that most patients will see. And again, this also varies from patient to patient. Some patients are easy bruisers. Some patients aren't very easy bruisers. Therefore, the bruising can last anywhere from about 2 to 4 weeks, depending on how easy every patient bruise. Additionally, the bruising generally comes from breaking the bones on the side. So for those patients who have a narrow bridge, who don't want the bridge messed with and you just want more of a tip, then the bruising isn't quite as significant or not nearly quite as significant. It's mainly when the bridge is being broken and the bridge is being narrowed or straightened, because most patients have crooked noses, then that's when the bruising usually kicks in. Great question. All my rhinoplasties are done in a closed fashion. You might hear of this as a scarless rhinoplasty. What that means is all the scars are inside the nostrils. I literally peel the nostrils inside out, make the cuts on the inside, go in and do everything I need to do, come out, stitch it closed, and we're done. It's almost like an endoscopic technique. Versus what we call an open nose. So an open nose, basically an incision's made at the base of the nose and around the rim, and the nose skin is peeled off, and then all the cartilage and the bone is manipulated that way. Again, I don't do it in an open fashion, I do it in a closed fashion, so all my scars are hidden. And again, a lot of times you'll hear this as a scarless rhinoplasty. Very good question. So I have a lot of very active patients and they want to get back to their lives, working out, and back to their active lifestyle. What I have patients do, as soon as you feel better, patients can go for walks, hikes, and very light activities. Again, the one thing that we talked about earlier in this video is that the swelling can last 6 to 12 months, but mostly within that first month, we have to make sure we control the swelling. So anything that's gonna cause the face to swell, so like running for 20 or 30 minutes or lifting heavy weights, I would hold off on, or even going on runs for 20 or 30 minutes. You know, again, lighter activities, yoga, Pilates, or even light weights, elliptical, you know, walking on the treadmill. Lighter activities I have patients do right away, but more of the heavier activities I would like patients to wait for approximately 1 month. Great question. So the splint again stays on the nose for 1 week. So when the splint is on, you can wear whatever you want, glasses, sunglasses on top of the splint, because it's a metal piece of material that's protecting the nose. Once the splint comes off at a week, I do want patients to hold off for 1 more week before they put sunglasses and regular glasses on. So basically 2 weeks before you can regularly and routinely wear glasses and sunglasses. As far as blowing the nose, same exact thing. Again, the splint's on there for a week. It's gonna be hard to breathe for the first week or so. Once the splint comes off, it'll be easier to breathe. And then usually for the next week, you can start blowing lightly. After 2 weeks, you can start blowing fully. So I generally have patients sleep on 2 or 3 pillows to make sure the head's a little bit more elevated than the body. Again, if the head is flat or even below the body, all the blood runs to the face and causes more swelling and more bruising. So as long as the head's more elevated, then the blood will run down because of gravity. So usually about 2 or 3 pillows, you know, for the first couple of days, maybe a week at the most, just to help with the swelling. You know, patients can kind of go side to side a little bit. I just don't want them going all the way to the side where the pillow's pushing on the splints, but maybe like 45 degrees on one end, 45 degrees on the other. And I think the spectrum and then elevated on 2 or 3 pillows is a good recommendation for recovery the first couple of days to a week. The surgery generally takes about an hour to an hour and a half to perform for the average rhinoplasty. Again, depending on what we're going to be doing exactly, it could be longer or could be shorter. With anesthesia, it does take time to go to sleep and wake up, so the whole operation will probably take about 2 hours to go to sleep, to do the procedure and waking up. So those are the top 10 questions that I get about rhinoplasty procedures. I hope this was educational. If you have any other questions, I do a Q&A session on my Instagram stories every Monday. So check that out if you have some questions that you want to ask, or you can ask in the comments below. If you like our content, please subscribe to learn more about plastic surgery.